This interview is for an exercise in a course that I'm taking this semester. For the purposes of this exercise, do you consent to being interviewed and recorded?
Yes, I do. My name is Samantha Harvey, and I'm a pediatric nurse at Children's Hospital Colorado. It is the main campus here or out in Aurora. It is one of the top hospitals for pediatrics in the country. Yeah, so I have worked in the hospital in May. It'll be 7 years, and I've had 3 different positions. I've been a medical assistant, working below the nurses at the bedside. I've been a bedside nurse on a medical inpatient floor, and I've been a clinic nurse in a pulmonary clinic now for about a year. Normal day for me now would be going in and greeting the patient after they are roomed. I ask a multitude of rooming questions. I find out their primary concern of what brings them in today. And then I go and communicate that all to the doctor and help him or her with whatever tasks they need to complete for that patient's appointment. So I work with both a nursing staff primarily, and then a provider staff primarily. The nursing staff is about 13 of us, and 12 are female, 1 is male. And the providers, I would say, are pretty evenly split. I would say maybe 60% are male, 40% are female. So providers are a little bit heavier in male dominance. So the nursing staff has the same, I guess, priorities during the day. And all of our delegations are pretty much the same. It doesn't matter whether you're male or female. Everything is about equal. Everyone is expected to do the same things. It's pretty unilateral. Now, my experience on the floor does get a little bit different. So working bedside when people are in the hospital, we did have times when patients were, temporarily unsafe. And if they were a larger patient, a larger child, and were bigger than us, then we typically have to staff them with male providers just for safety purposes. I would say no, I am not treated differently based upon my gender, but I would say I am treated differently based upon my position. So yes, I don't think it's more so what sex I am, but the position that I hold within the facility. And I would say, depending on the provider I work with, I've had multiple experiences with both male and female providers, and I would say it varies whether you're male or female, how you treat me based with your seniority. I have had females treat me bad because they're above me. I've had males treat me bad because they're above me, but I've also had the opposite. I feel like by a patient it is a little different. In the clinic, not so much, but at the bedside, I experienced personally being, hit on by male father figures or people in the room. And I've heard of other females also being, unfortunately hit on while they're bedside. Okay. I have never seen a male counterpart be hit on by a mom or a female patient. But that being said, there's so few male bedside nurses that I feel like the opportunity doesn't present itself as often as it would for female nurses. So it's pretty even for providers and doctors, but for nursing, I still feel like it is at least 90% dominated by females. I think that adult hospitals are staffing more males than females, and I think it's just the need that the patients are heavier, they're bigger, they're adults, and fortunately, someone my stature, which is most of the people that work in my field, they have a harder time, lifting and dealing with that all day. And I think it's easier for males, to deal with just with their body shape and size. Yes, I think people still perceive it as a woman's job and not a man's job. And I think it just goes back to, when nursing began, it was just female dominated and males were the providers, and that was kind of the stage that was set. And I think while today things are changing, like I said, I saw a lot of males in my nursing school cohort. Things are changing, but I don't think it has balanced out completely yet.